So we're going to start by grabbing the appropriate size harness for the patient and putting it in line with their hip bones. We're going to bring the harness around to the back of the patient's body and snug that top left strap. We're then going to attach the clips on the right side of the patient's body and snug them so the harness will stay in place. We are then going to go to the left side of the patient's body and snug those straps as well. Next, we're going to grab the two long straps hanging at the front of the harness and bring them through the patient's legs to attach to the hanging straps at the back of the harness. When we ensure that the straps are the appropriate length, we're then going to grab the upper body harness. The long strap of the upper body harness will go over the patient's head, and the two flaps will cross into a V formation at the front of the patient's body. The patient should look like this when the harnessing is complete. Once the harnessing is complete and the patient is ready to begin treatment, they can begin by slowly and carefully stepping onto the foot pedals of the machine. We will ensure the split in the table is at the appropriate height for the patient and that the computer is set up to the patient's profile. This includes the weight of the pull and the angle of the pull, which is an angle between L1 and L5. We then can begin by lowering the table into a horizontal position, placing the patient in supine. The strap of the upper body harness will come back over the patient's head and hang over the top of the table to be ratcheted in momentarily. The patient will be provided a pillow for support and comfort. Once the table is completely flat, we can grab our handy stool to assist us in tightening the harnesses we previously placed on the patient. We will start this by releasing the Velcro of the upper body harness. Once we check all of the lower body harness straps for any twists or tangles, we can begin to tighten the straps around the patient, going back and forth from right to left until all 6 straps have been tightened. We will then recross the upper body harness into that V formation over the front of the patient's body. Once the long straps that are connected from the front to the back of the harness are moved out of the way, we will assist the patient, if required, as we place a bolster underneath the patient's knees. The straps will then feed through a space in the bolster to attach to the machine. The silver ring of the harness straps attaches to a carabiner on the strap of the machine. This is where the pull for decompression therapy comes from. The top strap of the upper body harness will be ratcheted into the top of the machine until the slack is removed from the sides of the upper harness around the patient's body. This ratchet helps to keep the patient in place and from sliding down the table once the treatment begins. We can then slide the table all the way up and adjust the arm supports to ensure comfort. Once we start the treatment, we will stay for a few cycles to ensure the patient is okay. The treatment is 28 minutes and 13 seconds long. After one cycle, the split in the table will open 1 to 6 inches to provide a deeper stretch. The split opening should look somewhat like this. When the treatment has finished, we can take the patient off of the table. To start this process, we will release the Velcro of the upper body harness and unclip the carabiner at the bottom of the machine from the bottom harness. We will cross those long straps back over the patient's thigh to prevent them from tangling when we remove the bolster. We will then remove the bolster and provide the patient with some support if required. Once the bolster is removed, we can bring those straps back off of the patient's thigh and release the ratchet at the top of the table. Once those steps have been completed, we can lower the table if required to ensure the patient's feet are in contact with the foot pedals. We can then begin to bring the patient back into the standing position. Once the patient's head naturally lifts from the table, we can remove the pillow. Once the patient is in the standing position, they can be instructed to reach forward for the handlebars and pull themselves into an upright position. The upper harness can be retrieved and placed aside for proper sanitation. The patient will then slowly step down from the foot pedals backwards to ensure that there is no twisting of the vertebral column following their treatment. To remove the lower body harness following the treatment, we will unclip the long straps connected from the front to the back of the harness and bring them back through the patient's legs and into our left hand. We will hold onto the back of the harness with our left hand while we loosen and release the clips on the right side of the harness. The harness then can be set aside for proper sanitation. For cervical spine decompression, the table will be lowered until it is completely flat. The headrest will slide into a groove at the top of the table, and the strap can be released and placed to the side. The computer will be set to the patient's profile. This includes the weight of the pole and the angle, an angle between C3 and C7. When the machine is set, the headrest can be released and locked into the cervical machine with a special pin. A cable attaches from the machine to the headrest to provide constant feedback throughout the treatment session. When the cervical treatment has been set up properly for the patient, the technician will hold onto the top of the headrest for support while the patient slowly lowers themselves down into the headrest. The patient will be instructed to move any jewelry or hair to the right side of their body to prevent it from getting caught into the forehead strap. When the patient is laying down properly in the headrest, we then snug the forehead strap across the patient's forehead just above their eyebrows. The strap for the cervical machine will attach to the carabiner on the headrest. This is where the pull for the decompression therapy comes from. The bolster can be used to provide additional support and comfort for the patient during their treatment. The start button can be pushed to begin. The treatment is 28 minutes and 13 seconds long. When the treatment is complete, the bolster will be removed and set to the side for proper sanitation. The forehead strap will gently be released and removed from its place across the patient's forehead and set to the side. We will then hold the top of the headrest for support while the patient lifts themselves into a seated position to conclude their treatment. To remove the headrest, we're going to release the strap from the carabiner very carefully. We're then going to detach the cable that provides the feedback as well as the pin that locks the headrest into the cervical machine. Once that is complete, we can take the forehead strap and feed it back into the loop so that it is out of our way for transport. We then can take the cervical headrest to the side for sanitation.